What's going on, everyone? Welcome back to my channel. My name is Dr. Tom Walters and I'm an orthopedic physical therapist. In today's video, we'll be looking at exercises for upper hamstring pain. This is referred to as proximal hamstring tendinopathy. So if you've got pain kind of up at the bottom of your buttock area near your sit bone, the exercises in today's video will be for you. So when we're thinking about proximal hamstring tendinopathy, again, in this video, we'll look at a few exercises that can help reduce this pain, but there are a few other things you need to know. The hamstring tendon attaches right up here again on the sit bone. It's a part of our pelvis called the ischial tuberosity. That tendon will become irritated with certain activities in life that you want to be aware of. So one of them is prolonged sitting. As you can imagine, when I sit, it compresses that hamstring tendon and can worsen this issue. So that's a really common aggravating factor. If you're commuting a lot or in a job where you sit, just as much as you can, try to take breaks and get out of that position. The other thing is that hip flexion, when our knee is coming up towards our chest and our hip joint is moving into flexion, this also compresses the hip joint. So in life, that might be things like hamstring stretching. So in the beginning of rehab for this issue, we don't want to do a lot of hamstring stretching. It puts the hip into flexion and it can irritate that upper hamstring tendon. So if you're in yoga or classes like that, you may need to modify and avoid some of those movements. Also things like deadlifts, right? Like if I'm at the gym doing deadlifts, at the bottom of this movement, it can really irritate that tendon. So an exercise like deadlifts are a part of rehab, but they're at the later stages, kind of the end stages of rehab. In the beginning of physical therapy, we want to implement hamstring exercises that keep the hip joint closer to neutral or shallower angles of flexion. So when you work through this video, I'm going to show a progression starting kind of at the beginning of rehab and exercises to get more challenging and put more stress on the tendon towards the end of the video. So just find the right spot for you, which is going to be really finding the exercises that create no more than mild discomfort. So around a 3 or a 4 out of 10. If it's more pain than that, then just go back to the other level, or I'll show some other ways you can modify it. Let's get into the first one. All right, for all the exercises in this video, I'm going to show them all single leg, and I'm going to pretend like I have the pain on my right leg. I've actually had this issue in my right leg, so these are familiar exercises to me. If any of them are really challenging for you with the single leg variations, you can do all of them double leg as a modification. So just know that going into these exercises. With all the exercises in this video, try to go for 3 sets of around 10 to 15 repetitions. Just basically go until you're tired. So for the first one here, it's going to be a bridge exercise. Like I said, these are a little bit better to start with because the hip won't be in a deep angle of flexion. So I'm going to lie on my back, arms down at my side, and this bridge will be a little bit different in that I'm going to elevate my toes, which will help to bias it towards my hamstrings. My glutes will still, of course, work, but it's going to be a little more hamstring biased. On the leg that has the pain, I'm going to keep that one on the ground, and I'm going to straighten my knee out just a little bit. So normally a bridge, our feet are flat. I'm going to elevate my toe and straighten my knee just a little, and then I'm going to lift the other leg, push down with this heel, which will activate my hamstrings. So my hamstrings on this right leg are having to contract, which puts some tension on that upper hamstring tendon. And from the research, we know that when you're looking to rehab tendons, gradual loading through resistance training exercises has the best evidence. Better evidence than stretching, better evidence than soft tissue mobilizations. It might seem counterintuitive, but resistance training or strength training exercises, putting load on the tendon in an intelligent, kind of gradual way really helps to get rid of tendon pain. Okay, so again, for all the exercises, think about 3 sets of 10 to 15 repetitions, nice and slow. Like I said at the beginning of the video, if that's too painful, you can just go over and do a 2-legged bridge like this. If this is too easy, for most of these exercises, another option is to go up on 2 legs, lift the non-painful leg, and then do an eccentric contraction on the painful side. And then you reset, go up on 2, down on the painful side, and again working with the end goal of getting to full range of motion with just the painful leg. The second exercise will be called a elevated hamstring bridge. You can do this on a chair, or if you've got a weight bench like this at home. Again, I'm going to be focusing on my right leg, but you can do this 2 legs if single leg is hard for you. You're going to lie with your non-painful leg. You're going to kind of lie in front of the bench, and what's going to happen here is I'm going to put my heel of my painful side up on top of the bench. I'm gonna lift the other leg up above, rest your head down, arms at your sides, and just like the last exercise, perform a bridge. So now, of course, my hip joint is in a little more flexion, which applies a little bit more stress to that upper hamstring tendon up here on the ischial tuberosity. So like I said, for rehab with this issue, all the exercises will be hamstring exercises, but we're going to gradually increase the demand on the hamstrings, and we're going to slowly increase the angle of hip flexion. All right? Okay, so that's our second exercise. Again, looking at 3 sets of 10 to 15 repetitions of this heel elevated hamstring bridge. Third exercise, we're going to use a physio ball. I'll put a link down in the description for this and the bench I was just using if you need to get one of these tools. So for this, very similar to the elevated bridge, except for now we're going to make the hamstring challenge a little bit harder by bending the knee while we're in the bridge. So I'm going to put my painful leg up, lie on my back. Here, what I'm going to do is first push into the ball and do a bridge, and then bend my knee in. So this is pretty challenging for the hamstrings. Again, you can go to 2 legs if this is way too hard for you. This is getting a little later in rehab. You might not be able to do this for a few weeks if you're going through this issue right now. But again, here, just work through that 3 sets, going to fatigue. Something like this is pretty hard, and you might only be able to get 6 reps, something like that. That's okay. High load like this and tension on the tendon and the muscle are going to not only help build strength, but help that tendon get out of pain. All right, so that's our third exercise, a single leg hamstring curl. For the next exercise, we are going to use our weight bench again. This one really works best with a weight bench. A chair won't work so well, so you need something like this, an elevated surface that's about this height. This is a single leg hip thrust, so now we're going deeper into hip flexion. This is going to work our glutes and our upper hamstrings. So what you want to do is put your back against your bench, arms kind of out to the side. Your painful leg is going to be out at about this angle. You're going to lift the other leg and then drop down way into hip flexion and then push back up. So this is going to strengthen my hamstrings and my gluteus maximus, all of those muscles that are involved in creating hip extension. So kind of keep your chin tucked in, up and down, nice and slow, as deep as you can. If you feel pain on the way down, just stop at the point where you feel it and then come back up. Okay? So this one is the single leg hip thrust. Another thing that I didn't mention, and people often ask me, if you only have pain on one side, do these exercises on the other side. It doesn't hurt to strengthen the non-painful side, and it may actually, through this concept we have of cross-transfer, the cross-transfer effect, sometimes within the nervous system, training the non-painful side can actually help the painful side. Okay, so that's our fourth exercise, the single leg hip thrust. Here's our last exercise. We're gonna go to a single leg deadlift with a dumbbell. Again, this is super challenging, puts a lot of stress on that upper hamstring tendon. So this will be at the end of your rehab. Go through the other exercises. Only implement this when you can do it with mild or less pain. So again, that 3 to 4 out of 10. I'm gonna take a dumbbell that's challenging for me, stand on one leg, hand up on my pelvis, and I'm just gonna lower the weight and kind of tip forward. My other leg's gonna kick straight back, and a little bit of a balance demand here, but going forward until you feel some tension. If you hit a point of pain in the hamstring tendon, then just stop there, and then really think about kind of pushing your heel backwards into the floor as you come up to contract your hamstring muscles. You also can do this with a barbell and do a double leg deadlift. That's fine too. Whatever type of deadlift you prefer, but basically just going through that hip flexion range of motion deeper into that movement and really challenging the upper hamstring tendon. Okay, so that is our last exercise, the single leg dumbbell deadlift. Thanks for checking out today's video. I hope you find the exercises to be helpful. Just want to mention my book is available on Amazon and Barnes & Noble. It has rehab programs you can do at home for the most common conditions. Each body region has its own chapter. So if we go back to the hip chapter, we'll see that there is a hamstring pain program that's going to talk about hamstring strains and today's topic of proximal hamstring tendinopathy. All of the programs have 3 phases and have pictures of me doing all of the exercises. So again, you've got instructions for the exercises, and the phases build in intensity so that you can gradually rehab on your own. Very similar to if you were to come to see me in physical therapy and I gave you a program. I will put a link down in the description if you want to check the book out. Thanks again for watching today's video. I'll see you in the next one. Bye.